Hi guys, I'm Dr. R.SIVAKAMI. Today I'm going to take an online class in pathology. So first of all, I want to thank my wonderful and amazing teachers who gave me this opportunity. Because of the continuous inspiration, they have opened a new chapter in my life. And by using this online platform, I'm here ready to share my knowledge, what I gained from my wonderful teachers to the young budding students from various systems of medicine, a doctor, a dentist, a surgeon, a physician, and a veterinarian. Okay, now let's come to the topic. Today, I'm going to discuss about what is the general introduction to pathology. So, you all know that students from various medical fields in the second year, especially the medical students and the dentist, in the second year, they are familiar with the term pathology. So, what is pathology? It is nothing but a scientific study of disease. So, pathos, which means suffering, and logos, which means study. So, it is the study of structure and function of the body in a diseased state. In which condition? In a diseased condition. We should be clear of this term. Okay. We also use the term pathophysiology. So, physiology means a branch which deals with the study of function of organisms. So, pathophysiology means it is the study of disordered function or breakdown of homeostasis in disease. Okay, I will ask you, what is homeostasis? So, homeostasis is a condition in which you establish stability, a balance and equilibrium within the cell or in the body. So, the homeostasis is primarily controlled by our endocrine system and our nervous system, especially hypothalamus. Okay. So, in general term, homeostasis is nothing but a characteristic of a system which regulates our internal body to that of the external environmental changes. If there is any irritation or constant changes in the internal environment, it will lead to disruption of the stability and finally leading to a imbalanced state where you can lead up with a disease. So, the pathologists, they are basically a diagnosticians of disease. So, they will form a vital bridge from the initial preclinical learning phase to the final clinical phase. That is from your second year to your final year. So, you will be seeing lot of cases. In order to identify the disease, you should have a fundamental knowledge in pathology. So, what Sir William Osler, who is the founder of modern medicine in the late 19th and early 20th century said, your practice of medicine will be good as your understanding of pathology is essential. So, what the pathologist will do? They will actually find out the cause, the mechanism, the nature and type of the disease, and they will correlate all those things to form a diagnosis, and this report will be given to your medical practitioner and he will check with all the reports and finally come to a conclusion of giving a appropriate treatment plan to the patient, and thereby he will be reducing all his bad sufferings and also giving advice how to avoid the diseased state, and also he reduces the spread of infection, that is by giving a preventive medicine. So, here I have talked about disease. So, when you want to understand disease, you should know what is health. So, in 1948, the World Health Organization defined health as a state in which there is a physical, mental and emotional well-being without any affinity to the diseased state. So imagine there is a seesaw which is in a balanced state, is called health. If the seesaw is in balanced state, where one side there is high pressure and another side there is very low pressure, because of it get imbalanced, and this condition is called disease. So disease is nothing but an opposite of healthy. So in a common term, when a patient is not healthy, then he is in diseased state. So whenever we are talking about the disease, they will tell illness. What is meant by illness? It is nothing but reaction of an individual to the disease in form of symptom and signs. So what is symptom and what is sign? These are all the terms which you should be very thorough in your subject. So when I was doing my undergraduate, I usually confuse these two terms. What is a cardinal symptom and what is a cardinal sign? Cardinal symptom. So cardinal symptom is nothing but it is a complaint of the patient in his or her own word to the medical doctor. So for example, a patient will come to our general OP or patient department or in a private practice, and he will complain a bucket list like he is having a pain, he is having vomiting, he is having indigestion, and he is having a running nose, he is having a throat pain, and all these things which are a complaint of the patient in his or her own words to the doctor. So what we do, we will record that the patient complains of fever, high temperature, complains of a cough, complains of running nose, all this thing in our case sheet. So it is called cardinal symptom. Now I think you may be clear what is cardinal symptom. And now coming to the cardinal sign, it is nothing but a physical sign that is elicited by the clinician on physical examination. So for example, a physician, what he will do, our general doctors, our general medicine home doctors, what they will do, they will monitor our body temperature. Why? Because the normal body temperature is 37 degrees centigrade, that is 90.6 degrees Fahrenheit. When it goes above this level, you will be end up with fever. So he always check the body temperature, and also he will always monitor the blood pressure, and he will monitor our blood glucose level, and we will see for any bruises or injuries. And at the same time, I will say one condition where there is a clubbing at the end of the finger, which is most commonly attached to lung disease. So all these things are called as cardinal signs. Okay. So these signs and symptoms are usually non-specific, but however, it helps to come with a conclusion by narrowing what is wrong. I will explain. So before going to this thing, we should know what is a lesion. So an illness is nothing but a reaction of an individual to the disease, and lesion is the change in the tissue and the cell that is produced by the disease in an individual. Okay. So I said how you will diagnose using the signs and symptoms, because they are usually not specific to the particular disease too. So for example, I am having one patient who come to the outpatient department yesterday, and he complains of high fever, there is rise in body temperature, and he is very fatigued, and he is having a very intense muscle pain, and he is not able to take his food, loss of appetite, and he is having like very indigestion condition, and he is complaining of vomiting sensation. And when we took the hematological investigation, hematology means blood investigation, we found out that there is a low platelet count, and there is a very low white blood cell WBC and increased erythrocyte sedimentation rate ESR. I think you all students will be well versed with all these blood investigation terms in your first year of physiology. So low platelet, low WBC and high ESR count. Okay. Now we come to a conclusion that he is having a heavy rise, that is high body temperature, fever of more than 100.4 degree centigrade. Sorry, 100.4 degree Fahrenheit. So we come to a conclusion, either it is a viral fever or a bacterial fever. If it is a viral fever, it should persist for 4 or 5 days, that is within a period of 7 to 14 days, that is a 2-week period. But it is persisting more than 14 days, then we have a little bit of thought that why it should not be a bacterial fever. Then we started to take a throat swab. So this throat swab was positive for that particular patient. Patient means a person who is affected by the disease is called patient. So you should be careful. When you are calling a patient, he should be affected by disease. So the throat swab is positive and the fever is persisting for more than 14 days. And now we come to a conclusion that it is a bacterial strep throat. So we give a proper antibiotics that are sensitive for the particular bacteria, and thereby we are controlling the spread of the disease and the prognosis also very well. And we are also prescribing salt water gargle and taking plenty of fluids and good rest and sleep. So now you understand what is the role of a pathologist. So he will take over all the signs and symptoms and he will come with so many investigations, and finally he will end up with a diagnosis for getting a proper treatment plan. Okay, so I'm told that all these process they narrow down to come with the proper diagnosis. So what are all the things they will discuss? First one, why the disease happened. Let me tell you. What is the cause of the disease? So the cause of the disease is called the etiological factor. For example, what is meant by an etiological factor? For a patient having high blood pressure, hypertension, he is having a long time smoking index, and also he is having a lack of exercise and he is taking diet with high salt. Now, which are all the etiologic factors? High smoking index, diet with high salt, and also lack of exercise. So this is called etiological factor, the cause of the disease. Then the second question, how this disease mechanism has happened, that is the pathogenesis has happened. So for this you have to follow the 4 process. The first one is exposure. So exposure is nothing but when you come in contact with the infected person or a contaminated surface, food or drinking water or anything, you will be exposed to the particular pathogen. And this pathogen will come and adhere to our host. This is called adhesion. After adhesion, it will destroy our cell membrane, a protective capsule, and thereby it starts spreading inside. And this is called invasion. After entering our cell, it will produce lot of toxins like it may be an exotoxin or endotoxin depending upon the virulent factor of the microbe. It will end up with an infection. So the third question is, what are all the, I already told you, what are all the reaction of an individual to the disease in form of signs and symptoms. So after asking these 3 questions, that is your causative factor, the mechanism, that is the pathogenesis of the disease, and now you are seeing for the signs and symptoms. After getting all these answers, now you go for the gross examination, that is a macroscopic examination with a naked eye. So in the gross examination, you will always study the morphology of the diseased tissue or organ. For example, they will always take a biopsy if there is any neoplasia like that thing. Okay. So in the biopsy, they will see for the morphological changes. That is, the size, whether the size is increased or shrink. For example, in Alzheimer's disease, what they generally complain of, the brain size will be shrink than that of the normal. Because of this shrinking size only, the neurotransmitter connections become very less, and like in dementia like condition also this is happening, and it leads to poor memory, so the memory loss. Likewise, you have to do a gross examination, that is a morphological examination, to see the size, the borders and the color changes. Okay. So after doing the gross macroscopic examination with your naked eyes, then you have to go for the study using a microscopic examination. In this microscopic examination, we normally take the biopsy solution, we put it in a formalin and we go for various chemical procedures, and finally the paraffin embedded tissue is sliced under a microtome, and it has been strained with a common DRAM strains, GEMSA, special strains, or immunohistochemical staining method, or any fluorescent dyes, and it can be studied under a light microscope. Common special any dyes are used, you can study it under a light microscope, or sometimes you need a fluorescent dyes, then you go for a fluorescent microscopy, and also you can use an electron microscopy, either it is a scanning electron microscopy or a transmission electron microscopy. So first you are ruling out what is the causative agent, the mechanism of the disease process, the signs and the symptoms, and then coming with a naked eye examination, that is the physical examination. After doing that, you are going for a study under a light microscope or an electron microscope or a fluorescent microscope. Then after doing this, you go for a blood hematological investigation. So in this, we will collect the blood fluids and see for various abnormalities. Not only you are going to collect the fluid like blood, you are going to collect other fluids like the cerebrospinal fluid, because in meningitis you will always collect the cerebrospinal fluid in which it shows a low glucose level. Okay, the cerebrospinal fluid, the urine sample, the semen, etc. So after doing these investigations, if you want further more investigation, then you go for cytopathology. So what is meant by cytopathology? It is nothing but the study of the shedding cells, which is in which the lesion is either superficial or deep-seated. This technique is called as fine needle aspiration cytology, or otherwise you go for a molecular pathology, where you can study the genetic material using various molecular probes like a real-time PCR. PCR is nothing but a polymerase chain reaction, a flow cytometry, a Western blot technique to study the genetic pattern of the disease. And it is give a very correct, absolute and immediate result that are very helpful for research purpose too. So after all this investigation, you come up with a diagnosis. This is like, I want to say, for example, if there is a crime is happening, what happened, the officers, the investigators, they will come to that site and they will get all the clues that has placed there, and they will collect all the clues, they club together, and finally they will correlate the event that has been happened with these clues and come to a conclusion. Similarly, here the pathologist explained all the things that they will come and investigate about the etiological factor, the mechanism of the process of the disease, the signs, the symptoms, and they are studying it under a naked eye, that is a gross examination, writing the features about the color, size, texture, and its border, everything, and then studying under a light microscope or an electron microscopy or a fluorescent microscopy, because in microscopy only you can, in detail, you can record the morphology of the cell. For example, a normal cell, it is having a central placed nucleus and a cytoplasm. The ratio of cytoplasm to the nucleus will be high in a normal cell, and there will be a one nucleus in the center, and inside that nucleus you will be having a nucleolus with a fine genetic material, that is your double standard DNAs. But what happened in a neoplastic cell, that is neoplastic means a tumor cells, that is a cancer cells, you are having high proliferative activity, you know that. Because of the high proliferative activity, they will be undergoing like a poor proliferation, that is poor like metaplasia, like stages anaplasia. So what happens? The cytoplasm nuclear ratio will be changed. For example, you take an omelette in which the yolk part is the nucleus, which is decentralized, and your cytoplasm will be the white part of the egg. So the ratio of cytoplasm to the nucleus is altered, where the nucleus size will be bigger than that of the cytoplasm, and you will be having a bipolar nuclei, and also within the nucleus you will be having a multinucleoli, and the genetic material will be very porous in nature. So all these things you can record with the microscopic examination, and you can stage the cancer into a poor, middle or early stages of differentiation. So if it is very poor means, then you have to combine the treatment with chemotherapy and radiation therapy, and also you can say that the prognosis will not be very good. Prognosis means after the treatment, the patient, their life will be very less when compared to that of the early stage of cancerous lesion, stage 1. Okay. After doing this microscopic examination, you also do the blood investigations. Not only the blood, I also told that various fluid also you can come under the investigation. After doing this, if needed, you go for a cytopathology or molecular pathology, because molecular pathology, they are very expensive, and if some details are very necessary, you can go for molecular pathology. After doing all these things, he will come up with a diagnosis, and he type the report and he will give it to a medical practitioner, and the medical practitioner will take the diagnosis and he will make a appropriate treatment plan, and thereby he will reduce the spread of the disease by giving a preventive medicine. I think you all guys will understand the topic, because today I have taken the introduction to pathology only. So if you want any doubt, write in my comment box, and if you are interested in some other topic regarding this field, you can write it in my comment box, and I assure I will be sharing my knowledge with you. Thank you guys.